Next, we'll discuss aseptic techniques and practices used within the various primary engineering controls. Aseptic technique, that is, methods used to manipulate sterile preparations so that they remain sterile, should be used while working in any of the primary engineering controls. The following principles are important to understanding how to use aseptic technique properly within a primary engineering control. Within a laminar airflow workbench, the space between the HEPA filter and the sterile object is known as the critical area or critical site. First air is HEPA-filtered air that washes over the component in the compounding work area. Because the air downstream from non-sterile objects may become contaminated with particles, a direct path of first air between the HEPA filter and the critical work area inside the hood must be maintained. Your hands should never enter first air or obstruct airflow around the area where the needle enters a vial or ampule. The zone of turbulence refers to the air turbulence created inside the critical area by an object in the direct path of the first air. This zone of turbulence could potentially extend outside the hood, drawing contaminated room air into the aseptic working area. Remember, when laminar airflow is moving on all sides of an object, the zone of turbulence extends approximately 3 times the diameter of that object. And if laminar airflow is not accessible to an object on all sides, the zone of turbulence may extend 6 times the diameter of the object. That's why you should work with objects at least 6 inches from the sides and front edge of the hood, and be careful to keep your hands out of the airflow in the critical area between the HEPA filter and sterile objects. The following list outlines aseptic practices for working in the compounding environment. Remove all makeup and jewelry from your hands and wrists. Be sure to wash your hands and arms before entering the hood. Wear appropriate personal protective equipment such as gloves, gowns, masks, and hair, eye, beard, and shoe covers. Keep your hands within the cleaned area of the hood as much as possible. Do not touch your hair, face, or clothing. Remove excess dust from items before introducing them into the compounding work area, and perform all calculations before entering the hood.